Hello everyone, my name is Frank Hsu. I'm a physical therapist from San Francisco Pain Management and physical therapist. Today I would like to introduce an exercise specifically designed for the neck pain. So there are various conditions that can lead to the neck pains. It can be simply as neck sprain, whiplash injury, to spinal stenosis. But all of these conditions will lead to one big problem, which is a core muscle weakness. Many studies have shown that our core muscle will become weak within 2 to 3 weeks following the injury or operations. So our core muscle plays a significance to protect our spine. Without our core muscle, our spine will become less stable, which will be more prone to further injury. Today, the first exercise I want to teach is a core muscle activations. Okay, the first exercise is to activate our core muscle on your cervical spine. It's very easy. First, tuck your chin in and retract your scapulas. In this way, you will start to activate your core muscles. To further strengthen your core muscle, we can provide a gentle resistance with our hands. First, we can put our hand on the head to provide a gentle resistance for 5 seconds. Then we will switch to a different directions for another 5 seconds. Then we can do it at the front, then from the behind. The last two, one is for rotations. We'll use one of hands to touch the opposite of the chin, and another hand put on the back of the head. And we tend to rotate and do not move your head for another 5 seconds. Then we switch to a different directions. So those are the exercises to strengthen our core muscles. Our core muscle is very important to stabilize our cervical spine, which is our necks. From C1 to C7, there are 7 cervical vertebrae which compose as a cervical spine. So with a stronger core muscle, we can actually have a more stable spines. With a sufficient strength in our core muscles, we can actually reduce a lot of stress and loading onto your soft tissues such as ligaments, joint capsule around the facet joint in your cervical spine. The next exercise we're going to do is stretching exercise. Because of the neck pains, it will cause the muscle to contract, and eventually it will put our posture into a guarding position. It will be the forward head and round shoulder. And this is a very poor posture we want to avoid, because over time our neck extensor will become tight, and we frequently put the cervical spine into the neck extensions. It will put extra loading and stretch on our facet joint of the cervical spine, and eventually it will lead to the degeneration of the joint at the cervical spine. So the exercise first we want to do is to use one of your hands to grab the edge of the table or the desk. Then you side bend to the opposite side till the end range is reached or you feel the muscle is being stretched. Then you use your another hand to stabilize your head. And remember, do not exert pressure onto your head because you do not want to damage your cervical spine. Remain in the stretching position for 5 to 10 seconds. Then we will switch to the other side. And the next one is again, grab the edge of the table with your one hand, rotate to the opposite side, and look down to the end range. When you feel your muscles being stretched, use another hand, put on the top of your head to stabilize your head. Again, stretch it for 15 to 20 seconds. The last stretching exercise is to pull your chin close to your chest. Then put both of your hands behind your occipital bones. And then gently let it go down. Maintain this posture for another 15 to 20 seconds to stretch your neck extensors. Then the stretching exercise will be finished. All of those stretching exercises will be really good to correct your postures, to lengthen your neck extensors, and reduce the stress on your cervical spine, and eventually lead to the decreased pain in your cervical spine. So those are the basic strengthening exercise for your core muscles and the stretching exercise to correct your posture. There are so many different exercises we can do to help reduce your neck pain. Please come visit our mission clinic, San Francisco Pain Management and Physical Therapists. We are open from Monday to Friday from 9 a.m. to 6 p.m. Thank you for watching this video.